doing to stop the layoffs? At the end of the day, a fight over health care policy drove the current federal government shutdown. The American Care Act tax credits are important for people who don't get health insurance through their job or a public program like Medicare or Medicaid. This year, enrollment hit a record 24 million people. Now, that's about 7% of the population. But within this group are people like small business owners, farmers, and ranchers. Gary Wettish is the president of the Minnesota Farmers Union.
A lot of farmers are going to be faced with choice. Buying a health care insurance policy versus making their loan payment to keep themselves out of foreclosure, or in some cases, putting food on the table.
So the question is, why do these tax credits matter, and is the matter so urgent?
Well, one big reason the enhanced premiums are set to expire at the end of the year. Now, this all goes back to the Inflation Reduction Act passed in 2022 when Democrats were in control of Congress and the White House. It extended those tax credits through 2025, which of course has just less than 3 months left. Republican House Speaker Mike Johnson addressed that timeline.
That is a provision that does not expire until the end of December, December 31. We are in the beginning of October. They're trying to make a December policy issue. Wait a minute. Part of the argument for a stopgap funding measure in Congress. That is not the issue.
Democratic senators say by that point it will be too late.
When it comes to people's premiums, this is not a December problem. It's not a January problem. It's a now problem.
That's because open enrollment begins November 1st, which means notices will start going out now with plan options for individuals and families. That includes monthly premiums and out-of-pocket cost-sharing amounts. I'll take a look at this right here. We have a report from a nonpartisan health research organization that shows the expiration of the tax credits could more than double what enrollees currently pay for annual premiums, a 114% increase from an average of $888 this year to more than $1,900 next year.
Right now, lawmakers have two options. Both do have downsides. The Congressional Budget Office estimates letting the tax credits expire would lead to about 4 million people becoming uninsured. But extending the policy would cost the government $350 billion over 10 years.
These tax credits are only for U.S. citizens and immigrants with legal status. Republicans have pointed to another part of the Democratic funding proposal that would reverse a recent measure that narrows Medicaid eligibility for non-citizens, something Vice President J.D. Vance brought up yesterday.
If you're an American citizen, you've been to a hospital in the last few years, you probably noticed that wait times are especially large, and very often somebody who's there in the emergency room waiting is an illegal alien, very often a person who can't even speak English. Why do those people get health care benefits at hospitals paid for by American citizens? The answer is a decision made by the Biden administration that the Trump administration, working with congressional Republicans, undid.
We want to note the new Democratic proposal would extend Medicaid coverage to immigrants with some type of legal status or government protection. However, until this part of the proposal gets worked out, a law passed in 1986 requires hospitals to ensure access to emergency treatment regardless of a person's ability to pay.